Hi, I'm Mary Wong, Chinese medicine practitioner and acupuncturist, founder of Alive Holistic Health, and author of Pathways to Pregnancy. Welcome to my live post number 74. And tonight, I'm really honored to be able to interview Dr. Prati Sharma, who is the founder or co-founder of Conception Diaries. And before I introduce you to her, I want to tell you why this was a conversation that is important to me. The reason being is that in my book, I talk about limit your time on Google, meaning that unfortunately, when you consult Dr. Google in the wee hours of the night, oftentimes people go on it for hours. And what you end up doing is get overwhelmed and you get misinformation. And often it's like you land on these chat lines with groups of women that are basically telling you their own personal experiences, which may not be relevant in your case. So the reason why I'm inviting Dr. Prati on, Dr. Prati Sharma on today is because we want also valuable, reliable sources of information. So I'm going to bring her on. I'm going to introduce you to her and her lovely face. Hello there, Dr. Sharma.
Hi, Mary. How are you tonight?
I'm great. Thank you for being here with us this evening. I want to introduce you to everyone so they get a handle on who you are and why I think you're awesome and a great, reliable source of information. Okay. So Dr. Sharma here is a American board certified reproductive endocrinologist and infertility specialist who practices at Create Fertility Center in Toronto. And Dr. Sharma did her OBGYN residency at the prestigious Cornell University and then did her fellowship in infertility at Columbia University. So both of these places are in New York City. She then moved to Toronto, started her clinical practice at Create, and she's been a practitioner for over 10 years now. So that's a lot of experience. She has a keen interest in teaching, and her clinical areas of expertise include IVF, which is in vitro fertilization, ART, which is assisted reproductive technologies, PCOS, which is polycystic ovarian syndrome, and then treatment of poor responders and social egg freezing. Currently, her newest endeavor is the Conception Diaries, a fertility blog dedicated to educating young women or women and men about their reproductive health. So welcome.
Thanks so much, Mary, and thanks for having me on the stream tonight.
Absolutely. And so I think my very first question is, first of all, what is Conception Diaries?
So the Conception Diaries is a fertility-related blog that's designed to do exactly what you said, and you really summarized it perfectly. There's so much information out there on the internet about reproductive health, and I think particularly when it comes to fertility, women are very keen on expressing their own personal experiences. And as you said, it can really freak patients out. And patients come to me all the time talking about what they read on Dr. Google and if it applies to them. And so the Conception Diaries is a consolidated space on the internet where you can find reliable evidence-based information that's coming from young women who are women who went through this situation and are also fertility doctors themselves. So our goal is to really connect with the audience, but at the same time give productive, valuable, and evidence-based information about female reproductive health and options for your fertility.
That's great. So how did you come up with this idea? Like, why? Because I know as a reproductive endocrinologist, you have a very full day.
Yeah. Well, it's quite interesting because about a year ago, I started seeing how many of my patients would come in and say, I'm up at all hours of the night on the internet, and I have this, article that I read, and they would just come to me with these little tidbits of information that were isolated pieces that were really outside of the box, and they really focused on these tiny things that were so irrelevant. And I said, it's easy to get sort of drawn into the internet and think that what you're reading is absolutely true. And I said, I think patients really need a source that's not only based on evidence and data, but also something they can read and understand and be practical and applicable to their everyday life. So I sort of wanted to create an in-between, not like the layperson who writes their story on the internet that's maybe not the truth or not evidence-based, and not some article that a layperson, like a patient who comes into my office, wouldn't be able to understand because there's too much technical jargon. I wanted something in between where we disseminate information that's evidence-based, but in a conversational manner that's easy to understand, small snippets of information that you could read in a few minutes and take a message home.
Yeah, and I think it's really brilliant. I went on it and I looked at it, and there's a lot of wide topics. So it's not just, specifically IVF related, for example.
Oh God, no. I mean, it's really, the whole idea was meant to be a little bit more global and just sort of educate not just women, but men, single people, any population that's interested in knowing more about their reproductive health.
So then today, tell me some of the topics that you have touched on.
Yeah. Well, it's been a really exciting year. And when we first started this blog, we kind of decided to highlight sort of the big headlines. And so some of those would be egg freezing, which is a prevalent topic in social media. Young women are really thinking more and more about preserving their fertility. So this was one of the highlights that we talked about. We also talk about polycystic ovary syndrome, which is a very common endocrine condition for young women. We talk about what to do if you're single, other options, including getting pregnant on your own, using donor sperm. And of course, we touch upon things like in vitro fertilization. And nowadays, there's so many technological advances with IVF, genetic testing of your embryos, freezing embryos and putting them back in later, using donor eggs. And so all of these things can get really confusing for the patients. And so we try to tie down each topic in a way that's understandable to the patient. So that's just to name a few. We're also looking at talking about recurrent pregnancy loss. I'm doing a blog currently that should hopefully be up soon on male factor. We don't want to ignore the male part of the fertility component.
Absolutely, because, they are half of the equation, so we can't forget about that. And you know what? I don't want to forget that we actually did a blog together as well. So
we did. We've actually had 2 or 3 blogs on complementary medicine and the benefits when combined with fertility therapy. So yours and mine is a more recent one, and we've actually gotten lots of hits on that blog. So definitely take a look for the audience out there.
And that's great too, because, I think one of the things that women and couples want is the ability to have doctors be okay with other things that they're doing, right? And so to have you talk about it up front, and gives them a sense of surety and that, wow, okay, she's got my back and she's a doctor. I don't have to hide it from her. And in fact, anyone out there, that's the last thing I want you to do is to hide whatever you're doing from your doctor.
Exactly. And that was also a goal of the blog, to say that different practitioners could work hand in hand, and together we can complement a patient's ultimate goal. So you make a good point there.
Thank you. So, we talked about some of these blogs, but as a reproductive endocrinologist, and we have people hanging here, and what is your, let's not just say one. Are there like 3 top pieces of advice you would give to someone coming into your first time trying to conceive? And let's say they've been trying for, over a year, 2 years, something like that.
Yeah. What I tell people when they come in, because you're right, patients are hanging on to their last thread. They think it's never going to happen. They've been trying for a while. So really, if I had to break it down to my top 3 pieces of advice or words of wisdom, let's say, one is knowledge is power. I think knowing the right information and knowing about your body and yourself and where you stand is really important. So I think, even before you get to that point of having tried for a year or 2 and then going to a fertility doctor as a sort of last resort, I actually think the opposite, that patients should come sooner rather than later, maybe even when they're still single or in an early relationship, and find out about their own personal fertility, learn about their bodies, and learn about the options out there, because then you take control of your life and you really can plan based on knowledge that pertains to yourself. So That's number one. And number two would be to stay positive. One of my sort of taglines is that everyone can have a family. It might not be in the exact way that you thought. I think one of my blogs actually starts with this, where I say, the age-old tradition is first comes love, then comes marriage, and then comes so-and-so with the baby carriage. But it's not quite like that anymore. The world is changing. People are having children as a single person. People are getting pregnant when they're not married. People are freezing eggs and embryos. So there's so many different ways to do things. I think everyone can have a family, and it's really important to look outside the box and think about all those options, and you'll never know if you don't come into the fertility clinic. And the third is, I kind of touched upon it with the first two, is it's never too early to get an evaluation. So, don't think you have to wait that full year of trying. You can even come in when you're not thinking of trying and you just want to learn more about your fertility and where you stand, whether that's male or female.
That's great pieces of advice. And, all three of those things I adhere to myself. And I actually do mention that in the book too. So, there are people out there that are watching that are so tied to, oh my gosh, everything has to be completely natural. Well, one of the first lines of defense, in my opinion, is to be empowered by knowing where you're at, getting your baseline, right? And whether or not you have to do IVF or that's a whole separate conversation. Let's just see where you're at and then see how we can help you in your fertility or reproductive way of being, because there are things naturally that you can do for yourself as a baseline, right? Before you have to consult and do more assisted reproductive technology. So thank you for that, for sure. Thank you so much for being here. And I'm really excited that actually, so you touched upon genetic testing. Did you do a post on that yet?
We did. It was probably about a month ago. My colleague, Dr. Chan, posted a blog on PGS. And that's like a good example. Like, PGS can get so unbelievably technical if you read some of the papers out there, and it's easy as a patient to get confused. And so if you look at our blog, it really breaks it down and talks about it in a very simplistic way. I mean, not overly simplistic, but simple enough so that the average person can understand. And I find a lot of patients get lost even when they come to the fertility clinic, because they get all these technical terms thrown at them and they're like, okay, just sign me up for everything. But you really need to understand what you're doing. And so that's the goal at Conception Diaries, that we can help navigate the process by putting things into simpler terms that are easier to understand.
Totally. Thank you. And, I'm going to read that article sometime this week, because next week I'm actually going to talk about PGS testing, which is pre-implantation genetic screening. And it is everywhere. Everybody's doing it. Everybody's testing it. And I just went to the Canadian Fertility and Andrology Society. It's called The Gatekeeper's Dilemma. And I don't know, right? So I went to that, and that was really awesome. So I want to share with you what I learned and what I took away from that. And then at a later date, I'm going to invite Dr. Casper, who's the head researcher as part of this, to be interviewed for that as well. So I'm excited about that. And then I'll have more posts on recipes, and then you can always give me as a viewer some ideas as to what you would like to see on here. And in future, I will talk about endometriosis as well. So just so you know, hang in there, it's coming. And so thank you this evening for joining me. Thank you, Dr. Sharma, for being here. I know it's late and you've got kids and, it's time for bed.
Well, it's my passion, so I really appreciate it. I've been looking forward to this. And to the viewers out there, please check us out at conceptiondiaries.com and see what we're all about. Thank you so much for having me tonight.
Oh, thank you for being here. I'm going to just put you over here. And again, thank you for joining us this evening. And check out other video vlogs. This is number 74, so there's a lot of ones before that. And also check out my website, marywong.life, for my blogs and my book, Pathways to Pregnancy. And join me next week, Wednesday, 8 p.m. Eastern Standard Time. See you. Mwah. Have a good evening. Bye for now.